Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. First-year ministerial performance retreat opens in Abuja. Government attributes difficulty in implementation and monitoring of projects to COVID-19 pandemic. More state chapters of the Nigeria Association of Resident Doctors, NARD, join nationwide strike as doctors' action threatens the health sector. And India overtakes Brazil in the number of infections recorded, now second to the United States, with more than 90,000 new cases of COVID-19 in the last 24 hours. 100 cases of COVID-19 was reported by the Nigeria Center for Disease Control (NCDC) Sunday night from 9 states and the FCT, with Lagos recording 39, the FCT 22, Kaduna 19, Oyo 7 cases, 6 in Ebonyi, Edo 3, 1 each in Katsina, Ekiti, Bauchi, Nasarawa. It's the country's lowest daily figure in almost 5 months. Total number of infections in the country is now at 55,005 cases. Active cases have dropped to 10,935, while 43,013 persons have recovered. The nation has lost 1,057 people to the disease. For about 2 weeks, Nigeria has been reporting cases below 300, indicating a slowing of the disease in the country, which experts have also ascribed to low testing across the country. According to the Presidential Task Force on COVID-19, collection of samples declined grossly in at least 6 states across the country in August. The number of deaths from the virus has also been low. Sunday's figure also represents a decline of about 40% from the 745, Nigeria's highest daily infections, which was reported late June. In the meantime, President Muhammadu Buhari is in Niger Republic to participate in the 57th ordinary session of the ECOWAS Authority of Heads of State and Government. A presidential statement says the president will present a special report on COVID-19 pandemic in the one-day summit. President Buhari was appointed the ECOWAS champion in the fight against COVID-19 during the extraordinary virtual summit of ECOWAS on the 23rd of April 2020. Like every other part of the world, Africa has been affected by the pandemic, with over 1.2 million infections and more than 31,000 deaths occasioned by the virus have been recorded on the continent. Cases in the West African region are presently at 164,365, with 2,465 deaths and 139,288 recoveries. Top 5 countries in the West African region with the highest confirmed cases are Nigeria, followed by Ghana, Côte d'Ivoire, Senegal, and Cape Verde. The first-year ministerial review retreat is ongoing presently in Abuja, with the Vice President, Professor Yemi Osinbajo, declaring the session open. The retreat is meant to review the performance of the ministers since their inauguration 1 year ago. The event is built to last for 2 days and has the ministers, special advisors in attendance. The Secretary to the Government of the Federation, Mr. Boss Mustafa, in his opening remarks, lamented the difficulties in the project monitoring by the federal government.
While acknowledging that we have been unable to effectively track and monitor fake approved policies, projects and programs as earlier envisaged due to the lockdown arising from the COVID-19 pandemic, I assure you that the process will be accelerated by our delivery unit in the coming months. In preparation for this retreat, a ministerial self-assessment template was completed by all ministries. This had helped in facilitating the analysis of the performance of ministerial mandates. I am pleased to note that the self-assessment reports have been validated by the Office of the Secretary to the Government and its technical partners through engagement with the ministers. The report of the analysis and the synthesization of the assessment and the review of ministerial performance reports will be presented tomorrow during the technical session of the retreat.
A two-day retreat is supposed to create transparency.
The Vice President also advised the ministers to brace up for the challenges ahead and deliver in their service to the nation, irrespective of their current challenges.
I want to assure our compatriots that Nigeria is extremely mindful of that the government is extremely mindful of the pains that higher prices may mean at this time, and we do not take the sacrifices that all Nigerians have had to make for granted. We will continue to seek ways and means of cushioning the pains, especially for the most vulnerable in our midst. We will also remain alert to our responsibility to ensure that marketers do not exploit citizens by raising pump price arbitrarily. This is the role that government must play through the PPRA. This explains why the PPRA made the announcement a few days ago, setting the range of price that must not be exceeded by marketers. The advantage we have now is that anyone can bring in their petroleum products and compete with the marketers. That way, the price of petrol will keep coming down. The recent service-based tariff adjustment by the DISCOs has also been a source of concern for many of us. Let me say frankly that, like many Nigerians, I've been very unhappy about the quality of service given by the DISCOs. But there are many constraints, including poor transmission and distribution capacity. I've already signed off on the first phase of the Siemens project to address many of these issues. Because of the problems with the privatization exercise, government had to keep supporting the largely privatized electricity industry. So far, to keep the industry going, we have spent close to 1.7 trillion naira, especially by way of supplementing tariff shortfalls. We simply do not have the resources at this point to continue in this way, and it will be grossly irresponsible to borrow to subsidize generation and distribution, which are both privatized.
Nigeria will be receiving research and innovation support from the United Kingdom to respond to the threat posed by COVID-19. The UK government in a statement announced its continued support to vulnerable communities through the impact and challenges of COVID-19 with funding in areas of research and technology. According to the statement, the UK government has invested £7.2 million in 20 new research projects to provide healthcare to patients in remote parts of Nigeria, as well as mass vaccination capacity and protective equipment for refugees in other countries. King's College London will work with the University of Ibadan and other institutions in Africa to train healthcare workers, and this is also to test the effectiveness of remote health appointments as recommended by the WHO, where internet availability is limited. The University of Bath in the UK and the University of Lagos will also be leading a project to address the issue of limited COVID-19 testing capacity in Africa and rapid identification of COVID-19 hotspot. Only yesterday, the cybercrime unit of the Nigeria Police Force, Interpol, the National Central Bureau, Abuja, arrested 2 suspects for their complicity in a major multi-million euro scam touching on procurement of COVID-19 PPEs. Now, the suspect, a 50-year-old master's degree holder in cell biology, and another male, 41 years, an MD of an investment company in Nigeria, are said to have fraudulently obtained from one Mr. Friar Frederick Von Hand the sum of 1.5 million euros and another 880,000 euros as advance payment for the supply of COVID-19 PPEs, valued at 14.7 million euros. Joining us right now is the Deputy Commissioner of Police, DCP Frank Mba, and the Police Public Relations Officer of the Nigeria Police Force. He joins us from our Abuja studios. Thank you for joining us on the program.
Thank you, Millicent, and good afternoon to our team and viewers.
Tell us, when did the investigations into the fraudulent transaction on the procurement of the COVID-19 PPEs begin? And do you think that this affects, how does it affect Nigeria's relationship with Germany as we battle the coronavirus pandemic?
First of all, let me say that it has been a long-stretched investigation. If you look at the complexity of the case, you will understand very clearly that the investigators, particularly the detectives from the cybercrime unit of the Nigerian police force that currently being warehoused within the Interpol NCB here in Abuja, had to work day and night and spanning over several weeks before they could actually crack down on those suspects. And Millicent, this should not be coming as a surprise to Nigerians because actually you recall that at the beginning of this of the pandemic, at the peak of the lockdown, we did issue a press release where we actually warned about the likelihood of crimes of this nature occurring, not just within Nigeria, but also in other parts of the world. We made it very clear that scammers within Nigeria and other parts of the world are beginning to find ways, creative ways for that matter, to take advantage of the fears, the needs, and the fears and the needs generated by the pandemic. And that is also not surprising, because everywhere in the world, criminals will always take advantage of situations. They will take advantage of war situations. They will take advantage of pandemic. They will take advantage of natural disaster. They will even take advantage of big-time celebrations like Olympic and World Cup and find very creative ways to actually fleece innocent citizens of their hard-earned income. And that's exactly what happened here. These Nigerian fraudsters working with their cohorts in Netherlands presented themselves to a German-based, a German representative of one of the government agencies as representatives of a company that is based in Holland. That company, ILBN Holdings, is prominent and has a very good track record for actually producing high-quality PPEs. And without the original company knowing of what was going on, they creatively, cleverly, and criminally cloned their website and initiated transactions with a German, which eventually culminated in the sealing of this illicit deal valued at about 14.7 million euro. Two payments have already been made before the bubble went off. A 1.5 million advance payment, a 1.5 million euro advance payment, and another 880 euro payment. The money that came into Nigeria actually went through an account of Babatunde Adesanya, a Citibank account in London, and then from there it was moved to the Mustard Point account based here in Nigeria.
Yes, I must quickly cut in just because we don't have a lot of time and we're just about to go on break. And, we understand that some of these things you've mentioned are things that you will bring forward in court as you try the men. But I essentially want to know how this affects the fight in COVID-19 and, that relationship that we have with Germany under this pandemic, seeing as this has happened. How does it affect that relationship? If you can briefly tell us in just a few seconds.
I think this will actually help in strengthening our relationship between Nigeria and Germany. Rather than having any negative impact, it will actually have a very positive impact because the German people, the German government, and the German business community must have been encouraged by the timeliness of our action, the fact that Nigeria investigators, detectives from Nigerian Police Force, detectives from the Interpol National Central Bureau based here in Abuja have got the capacity to actually wade into this kind of case and uncover the crime and then try to bring the criminals to book. So rather than impacting negatively on our relationship with them, this for me, and I believe very strongly in that, will actually strengthen our relationship and shows that even if Germans are making investment in Nigeria, they can be they can be assured that their investments are protected, and we've got the capacity to tackle any unforeseen circumstances that might arise. There are criminals all over the world. Remember that even in this case, there are also accomplices who are not Nigerians, who are Dutch citizens working with their Nigerian counterparts.
We appreciate your time. Thank you so much, DCP Frank Mba. Thank you for joining us on the COVID-19 update.
Thank you.
We have more on the global response to the pandemic when we return. Please stay with us. The Nigeria Association of Resident Doctors have begun a nationwide strike at 8 a.m. today to protest conditions not met by the federal government. The NEC members of NARD say that in spite of the 21-day ultimatum, which since expired 17th of August, the government has not shown sincerity in the plight of doctors. For example, they noted that though an agreement was reached between the government and stakeholders in the health sector to pay the COVID-19 inducement allowances for 6 months, April to September, that payment only started for April, May and June in some institutions and the process abandoned. Others include failure of the federal government to procure group life insurance and death service benefits for all health workers, the revised hazard allowances, which were supposed to commence in September, and several other demands. The association has asked Nigerians to bear with them during this period of industrial disharmony. We have Dr. Gertie Chemeka Ayanwoke, an infectious disease specialist, and she joins us from Baton Rouge, LA, in the United States. Thank you for joining us on the program.
Thank you. I appreciate you having me.
I'd like to begin with how the United States is handling the daily cases of the virus, seeing as it is still #1 in the world.
Yes, it's really been a roller coaster over here, but we think that it's beginning to get better. However, we just came out from the Labor Day weekend. It'll take hopefully a few days, maybe a week or two, for us to see if what people did impacted in our general experience of the COVID-19. But the numbers seems to be coming down, although not at levels that we would have preferred. We keep trying every day.
Tell us about compliance levels. Are they better? And if you compare that to perhaps some of the figures you're seeing coming from Nigeria, we recorded the lowest cases in about 5 months. And what do you think we're getting right?
I think that the case of Nigeria, in terms of people listening to what's being said, some people are and some people aren't. Generally, it hasn't really hit Nigeria hard the way it was expected. And I think that we need to do further studies. We need to do researches for us to find out the real reasons. My guess would be that the Nigerian population is much younger and with less comorbidities, meaning other medical problems. So even if the seroprevalence is high, meaning even if a lot of people have the coronavirus, they may have no symptoms at all. And so it looks like it's not really affecting the people the way it should. In America, however, the challenge has really been because there's no national strategy. So it's like there's piecemeal and every state for themselves. And a lot of times, even in a state, a city might do one thing and another city is doing another thing. And so it's just varies. And that has, and you know, when stuff impacts one state, just because the fact that it's a country where people are free to move from one place to the other, it's going to keep doing the same thing it's doing right now, unless we have a national strategy. I don't see this abating anytime soon in the United States.
So
Unless,
going
of course,
forward,
when we get the vaccines.
yes, and that's what I was going to ask. Going forward, as an infectious diseases specialist, what advice would you give to Nigeria, the United States, governments around the world as to how to get control of the virus?
Well, I think the same advice we've been given. We would like to keep advising and advocating for all those measures that would like to flatten the curve, which I think literally most countries of the world are doing, which is the social distancing within 6 feet or 2 meters, wash your hands frequently, use hand sanitizers, cough with tissue. All those measures still will help us. And of course, countries should begin to position themselves to be able to get this vaccine to kind of help the population get to the point where it can prevent most of those patients that are at risk from even dying from this coronavirus. So that would be my advice. The same things we've been saying. In Nigeria, I'm not sure about all that we're doing to vie for vaccine, but we know that the Federal Ministry of Health released a press, they had a press release about the government of Russia giving them the vaccine or samples. And I'm not sure how that much is true. I heard they've corrected the statement. But what we would say is that it will not be wise at this time for us to take any vaccine that has not been through the phase 3 human clinical trials. That's the position of those of us here in the Association of Nigerian Physicians in the Americas. Because what would happen is, in the past, when stuff like that has happened, it has caused more dangerous and deleterious effects, and it will decrease the trust that the public have for taking vaccines. You want to make sure it's
Thank you so much.
Yes,
I really wish we had more time, but the corrected statement was indeed that the samples were still with the Russian ambassador, and you know what we had was a memoir of the contents of that vaccine. But we really appreciate your time. Thank you for lending your voice to this very important issue. Dr. Chimeka Anyanwoke, an infectious diseases specialist, thank you for joining us.
Thank you. Thank you for having me.
India now has the second highest number of infections in the world, overtaking Brazil. It's confirmed a surge of 90,000 new cases in the last 24 hours, bringing the national total to over 4.2 million. Its death toll is also the third highest globally.
Only 5 of India's states are responsible for more than half of the country's COVID-19 caseload. 4.2 million confirmed cases and counting. After overtaking Brazil earlier today, India now has the world's second highest tally. The 5 states, Maharashtra, Andhra Pradesh, Tamil Nadu, Karnataka, and Uttar Pradesh, also have the highest number of active cases. The country has also reported 71,642 deaths, the third highest in the world. This comes as the government continues to lift restrictions to try to boost the economy. Australia says it will secure almost 85 million doses of a coronavirus vaccine if 2 promising trials prove successful. Prime Minister Scott Morrison said the country had struck 2 deals that would allow free doses to be rolled out in 2021 if they were approved for use.
We take another significant step to protect the health of Australians against the coronavirus pandemic. A $1.7 billion agreement for the supply and production of more than 80 million vaccine doses.
Australia's 25 million people could begin receiving the doses from January.
Take a look at our website. It's channelstv.com. You find the latest updates on the pandemic, and all you need to do is log on, access the news there. You can see a story saying Nigeria's revenues have fallen by almost 60%, plus China showing off COVID-19 vaccines for the first time. That's the program this afternoon. We have another update at 6. Join us then. I'm Millicent Walker. Stay healthy.